Okay, so next group of our classification is the antibacterial drugs. And antibacterial drugs are divided into these six classes. First is the drugs which inhibit the cell wall synthesis. And the drugs are all the beta lactams, then vancomycin, cycloserine, and bacitracin. Then there are drugs which cause leakage from cell membranes. These are polymyxin, colistin, bacitracin, and amphotericin B. The next group is the drugs which inhibit protein synthesis. The drugs are tetracycline, chloramphenicol, erythromycin, clindamycin, and linezolid. Then drugs which cause misreading of mRNA are aminoglycosides. Drugs which inhibit DNA gyrase are fluoroquinolones. Rifampin interferes with the RNA function. Now coming to individual group. So in individual group, first one is the sulfonamides. Sulfonamides are divided into four groups, that is short acting, intermediate acting, and long acting. Another is special purpose sulfonamides. The drugs are sulfadiazine, which is short acting, sulfamethoxazole is intermediate acting, and sulfadoxine, sulfamethapirazine, these are long acting ones. Then there are drugs like sulfasalazine, silver sulfadiazine, mafenide, and sulfacetamide sodium. These are the special purpose sulfonamides. Coming to quinolones, first quinolone is the nalidixic acid. The other quinolones are norfloxacin, ciprofloxacin, ofloxacin, pefloxacin, which are first generation, and second generation one are levofloxacin, moxifloxacin, gemifloxacin, flulifloxacin, lomifloxacin, and sparfloxacin. Now the second classification is of the penicillins. Penicillins were the first synthesized antibiotics. Penicillin G is the natural penicillin, also known as benzyl penicillin. Then second one is the semi-synthetic penicillins. These are penicillin V is the acid-resistant penicillin. Then methicillin, cloxacillin, and dicloxacillin. These are penicillinase-resistant penicillins. Then aminopenicillins, carboxypenicillins, and uridopenicillins. These are the extended spectrum penicillins. And the clavulanic acid, sulbactam, tazobactam, these are the beta lactamase inhibitors. These are always combined with the extended spectrum of penicillins. Like amoxicillin is always combined with the clavulanic acid, which is known as the clafam or the amoxiclav. Our next group is the cephalosporins. Cephalosporins again divided into 5 generations. Here it is shown only 4 1. So the first generation contains cephalexin, cephadroxyl, and cefazolin. Cefazolin is a parenteral one. Then second generation ones are the cefaclor, cefuroxime, exetil, and cefprozil. And cefuroxime and cefoxitin, these are the parenteral. Now third generation is important. Third generation oral cephalosporins are the cefixime, then cefdinir, ceftibutane, ceftamate pivotal, and cefodoxime proxetil. Then cefotaxime, ceftriaxone, ceftizoxime, ceftazidime, and cefoperazone, these are the parenteral ones. And the cefepime and cefpirom, these are the fourth generation. It is again fifth generation drug. I think that is ceftabiprole. Ceftabiprole is the fifth generation. Now some other antibiotics. First is the monobactam. In monobactam there is only one antibiotic, that is aztreonam. Then carbapenims. Carbapenims contains drugs like imipenem, meropenem, ferropenem, and the doripenem. This imipenem is combined with the cilastatin. Now coming to aminoglycosides. So aminoglycosides are basically given by IV route. The drugs are streptomycin, tobramycin, netilmycin, gentamicin, amikacin, paromomycin, kanamycin, and chisomycin. And neomycin and promycetin are used for the topical purpose. So this is the classification of aminoglycoside antibiotics. These aminoglycosides are cidal drugs. These are basically used to kill the microorganisms. Now the next group is of the tetracyclines. So as the name suggests, the tetracyclines contains 4 rings in their structure. The examples are oxytetracycline, then tetracycline, which can be given orally or by topically in eye, ear, or on the skin. Then dimeclocycline, doxycycline, minocycline, and tigecycline. Tigecycline, I think it's a newer tetracycline. So these are the names of the tetracycline. Tetracyclines are the protein synthesis inhibitor antibiotics. Now coming to the next group. The next group is the chloramphenicol and macrolide antibiotics. So chloramphenicol, again there are 3 derivatives of it. First one is the plain chloramphenicol. Then there are esters of chloramphenicol like chloramphenicol palmitate and chloramphenicol succinate. So this chloramphenicol palmitate is the tasteless insoluble ester of chloramphenicol for liquid oral formulation, whereas chloramphenicol succinate is soluble ester of chloramphenicol for IV injection. Then macrolide antibiotics contain erythromycin group of drugs, erythromycin plain or base, then the esters like erythromycin stearate and erythromycin histolate, lauryl sulfate. The other macrolides are roxithromycin, clarithromycin, azithromycin, and spiramycin. Then lincosamide antibiotics like lincomycin and clindamycin. Then aminocyclitol antibiotic, that is spectinomycin. So this classification is based on the chemical structure. Now important here is the azithromycin. Azithromycin is taken 500 mg once daily, 1 hour before or 2 hours after food. And it is used for 3 days insufficient for most infections. So this azithromycin is given as a loading dose because it is having a high volume of distribution. So initial high dose is required to treat the to get the plasma concentration at steady state. Now other chemical structure based classification is glycopeptide antibiotic. So this glycopeptide antibiotics contains vancomycin and teicoplanin. The specific adverse effect with vancomycin is red man syndrome. And second is oxazolidinone. Example is linezolid. And there are some polypeptide antibiotics like polymyxin B, colistin sulfate, and bacitracin. So this polymyxin B causes leakage of the cell membranes. Then urinary antiseptics, it is commonly asked in exams. Examples of urinary antiseptics are nitrofurantoin, then methenamine mandellate, and nalidixic acid. So these urinary antiseptics commonly combined with the urinary alkalinizer. Now coming to next classification. So this is disease based classification. So first condition we are taking here is tuberculosis. So these anti-tubercular drugs there are various ways to classify them. First one is the first line drugs. These are shortly called as HRJDS, isoniazid, rifampin, pyrazinamide, ethambutol, and streptomycin. Then there are second line drugs. When this first line fail or their resistance develops, then we use second line drugs. Examples are the fluoroquinolone group of drugs like ofloxacin, levofloxacin, moxifloxacin, ciprofloxacin. Then injectable drugs like kanamycin, amikacin, and capreomycin. And there are some other oral drugs like ethionamide, prothionamide, cycloserine, terizidone, PAS, rifabutin, and thiacetazone. Now there is other way also to classify these antitubercular drugs. So these are divided into 5 groups. First group is the first line oral drugs like HRZE. Yes has been removed from this group, from the first line drugs, because it is injectable. So group 2 is injectable drugs. It contains streptomycin, kanamycin, amikacin, and capreomycin. Then group 3 contains fluoroquinolone group of drugs. Group 4 is the second line drugs, all that we have seen like ethionamide, prothionamide, cycloserine, terizidone, and PAS. And group 5 is drugs which are unclear efficacy like thiacetazone, clarithromycin, clofazimine, and linezolid. The antileprotic drugs again divided into 4 groups like sulfones, clofazimine, antitubercular drugs, rifampin, ethionamide, and other antibiotics like ofloxacin, moxifloxacin, minocycline, and clarithromycin. So these are the antileprotic drugs. Now next classification is of the antifungal drugs. So we commonly get these fungal infections, and these fungal infections are commonly known as the mycosis. So the examples of these antifungal drugs are there are some antifungal antibiotics like amphotericin B, nystatin, and hamycin, and griseofulvin, and echinocandin group of drugs like caspofungin, micafungin, and anidulafungin. Now flucytosine is one of the antimetabolite antifungal drugs. Azoles are commonly used in the treatment of antifungal infections. The examples of azoles are the clotrimazole, iconazole, miconazole, oxyconazole, ketoconazole, then fluconazole, itraconazole, voriconazole, and posaconazole. Then other drugs are the terbinafine, which is an allylamine, and there are some topical agents also like tolnaptade, andecyclinic acid, benzoic acid, and the other drugs. Now coming to antiviral drugs. So first we are taking the non-retroviral drugs for treating non-retroviral microorganisms. So first is the anti-herpes virus drugs. The drugs are idoxuridine, trifluridine, acyclovir, valacyclovir, famciclovir, ganciclovir, valganciclovir, cidofovir, foscarnet, and fomipizole. The anti-influenza virus drugs are amantadine, rimantadine, oseltamivir, and zanamivir. Then there are anti-hepatitis virus or non-selective antiviral drugs. Like for hepatitis B, we use lamivudine, adafovir, dipivoxil, and tenofovir. And for hepatitis C, we use ribavirin and interferon alpha. So these are the antiviral drugs. Now coming to antiretroviral drugs. So these are used in the treatment of HIV. So first is the NRTI, that is nucleoside reverse transcriptase inhibitors. The examples are zidovudine, didanosine, stavudine, lamivudine, abacavir, emtricitabine, and tenofovir. Then there are NNRTIs, that is non-nucleoside reverse transcriptase inhibitors. These are nevirapine, efavirenz, and dilavertin. Then there are protease inhibitors which end in navir like ritonavir, atazanavir, indinavir, nelfinavir, saquinavir, amprinavir, and lopinavir. Now this other are enfuvirtide, which is NT inhibitor, maraviroc, which is CCR5 inhibitor, and raltegravir are the integrase inhibitors. So these integrase inhibitors end in gravir. Now coming to treatment of malaria, so the anti-malaria drugs are here divided into are classified based on their chemical structure. So the drugs are the chloroquine, amlodipine, and piperacin. The bioguanides are proguanil. Then mefloquine is there, quinine, quinidine, pyrimethamine, primaquine, tafenoquine. So these are all anti-malaria drugs. Then sulfonamide groups like sulfadoxine, sulfamethoxypyrazine, and dapsone. Antibiotics like doxycycline and clindamycin can also be used. Then there are amino alcohols like halopantene and lumefantrine. Atovaquone and pyronidine are other drugs, and there are some sesquiterpene lactones like artesunate, artemether, arteether, and arterolane. Now coming to anti-amoebic drugs. So these anti-amoebic drugs are divided into two types like tissue amoebicides and luminal amoebicides. Tissue amoebicides, the chloroquine is used for extraintestinal amoebiasis only, whereas metronidazole, tinidazole, secnidazole, ornidazole, satranidazole, and imetin and dihydroimetin are used for both intestinal and extraintestinal amoebiasis. Now coming to luminal amoebicides, so the diloxanide furoate and nitazoxanide, these are luminal amoebicides, whereas tetracycline, paromomycin, these are antibiotic luminal amoebicide. And the other drugs are quinidoclor, diiodohydroxyquine or idoquinolone. So this is 8-hydroxyquinolines used as luminal amoebicides. Now drugs for giardiasis. So this giardiasis is again one of the protozoa. So the drugs used in its treatment are metronidazole, which is given as a 400 mg tablet 3 times a day for 5 to 7 days, or it can be given as a 2 gram daily for 3 days. Then tinidazole, secnidazole can also be used. Other drugs are nitazoxanide, quinidoclor, and furazolidone. Furazolidone, the dose is 100 mg 3 times for 5 days. Quinidoclor again 250 mg TDS for 7 days. So this is for the treatment of giardiasis. Now the next is the treatment of the trichomoniasis. For trichomoniasis, we give metronidazole, tinidazole, and secnidazole orally, whereas there are some drugs which are used intravaginally. The examples are diiodohydroxyquine, quinidoclor, metronidazole, and povidone iodine. Metronidazole is applied as 1% topical gel in vagina once or twice daily, and povidone iodine 400 mg inserted in the vagina daily at night for 2 weeks. Now drugs for leishmaniasis or kala azar. The drugs are amphotericin B deoxycholate, liposomal amphotericin B, miltefosine, paromomycin sulfate, and sodium stibogluconate. This amphotericin B is given as an IV infusion over 4 hours daily or on alternate day. Now the next classification in antibiotics in this is antihelminthic drugs. So these drugs for roundworm, hookworm, and pinworm are albendazole, mebendazole, pyrantel pamoate, piperazine, and levamisole. For threadworm, we use ivermectin and albendazole. For whipworm like Trichinella spiralis, we use albendazole and mebendazole. For filariasis, the treatment is diethyl carbamazine, ivermectin and albendazole. For tapeworms, we use praziquantel, niclosamide and albendazole. And for hydatid disease, the treatment is albendazole and mebendazole. So again, these are azole, but these end in dazole. Okay, endazole, endazole, and these were nidazole. Now coming to the most important classification, and that is anti-cancer drugs. So first is the cytotoxic drug. So these cytotoxic drugs act by killing the cancerous cell. So the examples are, first is alkylating agents like nitrogen mustards, miclorithamine, cyclophosphamide, ifosfamide, chlorambucil and melphalan, thiotepa, busulfan, then carmustine and blomustine, these are the nitrosoureas. Then dacarbazine and temozolomide, it's a triazine, and procarbazine, which is a methyl hydrazine. There are platinum coordination complexes like cisplatin, carboplatin and oxaliplatin. Then there are antimetabolites. Folate antagonists are methotrexate and pemetrexate. Purine antagonists are 6-mercaptopurine, 6-thioguanine, azathioprine and fludarabine. And then there are pyrimidine analogs. Now second is microtubule damaging agents. These are vincalcaloids like vincristine, vinblastine and vinorelbine. Then taxanes like paclitaxel and docetaxel. There is istramostine. Then etoposide is the topoisomerase 2 inhibitor. The topoisomerase 1 inhibitors are topotecan and irinotecan. And there are antibiotics like actinomycin D, doxorubicin, daunorubicin, epirubicin, mitoxantrone, bleomycin and mitomycin C. Then there are miscellaneous group of drugs like hydroxyurea, L-asparaginase, tretinoin and arsenic trioxide. Now the third classification in this anti-cancer drugs is the targeted drugs and hormonal drugs. So the targeted drugs, first is the tyrosine protein kinase inhibitors like imatinib and nilotinib. Then EGF receptor inhibitors like gefitinib, erlotinib and cetuximab. Sunitinib and bevacizumab, these are the angiogenesis inhibitors. Proteasome inhibitors is the bortezomib, and rituximab is a monoclonal antibody. Now there are various hormonal drugs also like prednisolone, then tamoxifen and toremepin, these are SCRMs. Aromatase inhibitors are letrozole, anastrozole and exemestane. Finasteride, dutasteride, these are 5-alpha reductase inhibitors. Then there are progestins also like hydroxyprogesterone acetate, estrogens, then fulvestrant, it's a SER down regulator, flutamide, bicalutamide, these are the anti-androgens, and nafarelin is a GnRH agonist. So we are done with the anti-cancer drugs. Now some miscellaneous group of drugs. So first is the immunosuppressants, calcineurin inhibitors, these are cyclosporin and tacrolimus. Then mTOR inhibitors like sirolimus and everolimus. Anti-proliferative drugs, it contains azathioprine, methotrexate, cyclophosphamide, chlorambucil and mycophenolate mofetil. Prednisolone is again glucocorticoids. And now there are biological agents like TNF alpha inhibitors, etanercept, infliximab, adalimumab, anakinra, interleukin 1 antagonist, daclizumab, basiliximab, interleukin 2 antagonists, muromonab is a CD3 antibody, and there are